Is yours like a 5 shift a week, 8 5/8, or how does that
It's
work? Because
so
that's one of the things I didn't like
I'm
about it was
salaried.
I couldn't maintain 312. Oh, you salary?
I'm
Okay.
salaried, which it can be a good thing and a bad thing. They still measure productivity points, and this is going to sound low, but I see about 5 patients a day, unless it's a specialized visit. In home health, we call our admission starts of care, and those visits can take anywhere from an hour and a half up to 4 hours was probably my longest one. Usually when they discharge from the hospital drops the ball, that's when you have, oh, we don't have orders for any of these wounds. They don't have any supplies. So
Yeah.
you're going in, you got to fix all that.
No, 5 sounds like a lot because you're traveling. Sometimes you're encountering a new place. You have intros, and then of course it's like, what's not happening to you? You have to call back. Like you
Yeah.
just said, they don't have this isn't happening, or we have to escalate this.
Yeah.
That makes a lot of sense. That definitely takes up the day.
Yeah. Yeah.
What is it? 8 hours typically, or 10, or
No, it's usually under. Okay, so if you're counting charting, my area that I go is the projects in the hood mostly. So you don't want to be hanging out with the bed bugs and the cockroaches and all that fun stuff
yeah.
too long. So if there's charting I can do outside of the visit, you go in, you do your vitals, you do your wound care, you do the mandatory stuff, but the little things I'll be asking, like, do you wear glasses? All the little forms we need to fill out. I'll be doing the verbal while I'm doing my physical assessment and so on, so that I can chart that outside of the visits. If I take that home, usually I'm charting for an hour or two after I get back. So it ends up being about 8 hours.
When I was in nursing school, I had community health. It was Philadelphia, and I went into those impoverished communities, and it's stunning. Not just from what real poverty looks like, multiple uses of an oven.
Yeah.
A lot of the places were quite filthy. I couldn't sit anywhere. There were
Yep.
visible cockroaches. There was visible droppings. There
Yeah.
was visible mold. It's not good to breathe in it. You don't want to touch anything. It's quite tricky. I can imagine what some of the
My
things.
go bag, I actually have an S hook that fits over a standard door, so I don't have to set my bag down anywhere if it's really bad.
See, little things like that.